Hello, and thank you for joining us for another episode of the Louisiana Public Health Institute's new Health Table Talk series. I'm Shalina Davis, your host and the CEO of the Louisiana Public Health Institute. I pray that you and your family are safe and well, and that you're finding ways to help support one another as we navigate through the impacts of the COVID-19 pandemic across our communities. LPHI is a statewide, community-focused nonprofit committed to ensuring that all Louisianans have a just and fair opportunity to be healthy and well. We do this by authentic partner and community engagement, using data and research for action, project design and implementation, policy and advocacy, technology solutions, and providing fiscal and administrative support to community-based organizations. We're headquartered in New Orleans and have staff in all 9 Louisiana Department of Health regions who work on everything from tobacco control and prevention to building healthier communities to supporting the whole health needs of individuals and families from early childhood to older adults. Everything that's going on right now in the world is still weighing super heavy on my heart and mind, as I'm sure it is for many of you. As a public health social work professional, I ask myself daily, what can I do within my sphere of influence to ensure racial equity? To ensure that Black, Indigenous, and people of color across Louisiana and the country have just and fair opportunities to be healthy and well. That the structures that exist within our health system, our legal system, our education system, and the list goes on, ensures that people of color have a fighting chance to live free of worry and stress, and that they too can attain good health, have access to high quality education, and see a legal system as one that actually ensures their safety and well-being and is not a threat to it. I join my colleagues in Commit LPHI to addressing these inequities and racism as a public health issue. And as a start, internally, we've begun to do the work. Our staff at LPHI are committed to creating a culture of health and racial equity within LPHI. We've had ongoing conversations with our internal equity work group that was created in response to Alton Sterling's murder in Baton Rouge in 2016 and serves as a safe space for staff to share and do work on equity throughout our organization. We've also posted a new position, a policy and equity director, to support LPHI and our staff and our community in ensuring a health and racial equity lens throughout not only our internal organizational policies, but throughout public policy. And I'm reminded that the work also must be done at the individual level. We must all take a look in the mirror and reflect on how our own individual experiences and biases play into everything we do and begin to challenge notions that have been ingrained in our psyches. Again, I call my partners, policymakers, and fellow Louisianans to join us in doing the work, identifying and adopting anti-racist policies so that we uphold the human right to be healthy and well and afford an equal opportunity for Black people to thrive, live, and breathe. I continue to have faith. I know that the world feels dark right now. However, coming together, we will force the light to shine through. Now let's get to our guest for today. Many of you who know me know that I believe public health is everything. Racism, as I shared earlier, is a public health issue. Equity is a public health issue. So today we're going to talk about a few topics that weave into these issues and how we can continue to fight for equity and social justice in public health. And to have this discussion and offer some insights, I'm excited to have Dr. Earl Nupsius Benjamin Robinson, Deputy Director of the Office of Equity and Partnerships and Health Equity for the Louisiana Department of Health, to share what's happening within his sphere of influence to address social justice and equity. And by way of introduction, Dr. Benjamin Robinson is a public health practitioner with over 19 years of experience and is an adjunct faculty at Xavier University of Louisiana's Public Health Science program. Since 2015, Dr. Benjamin Robinson has been distinguished by the American Psychological Association as a Health Equity Ambassador and is a practitioner scholar member of the Health Disparities Education Awareness Research Training, HSTART, Health Equity Scholars. Hi, Dr. Benjamin Robinson. Welcome. How are you doing today?
I'm doing good. Thank you so much for having me here, but also thank you to LPHI and your leadership for understanding the need to have, this conversation, but with the creation of the health table talks, I think, this is something that can benefit the state. And so thank you for doing both those things, developing the health table talks, but also taking time to create this conversation.
Thanks so much, Dr. Benjamin Robinson. So let's talk about social justice, racial equity, health equity. I know you have the honor and privilege to work on equity both in your personal life as well as in your professional life at the state Louisiana Department of Health. So can you first kind of share with us some of your thoughts on why it's important for us to address racial equity in public health, and what the Louisiana Department of Health is doing to address this important issue?
So I'll start with the latter portion of your question. I want to say that, COVID-19 before, um, while COVID-19 was happening and we saw that there were a number of African Americans, or African Americans in particular, were disproportionately affected by it, our governor, John Bell Edwards, saw the need to create the COVID-19 Health Equity Task Force. And so I'm glad to say that this task force has been in existence for, I believe, about 30 days now, and its responsibility is centered in health equity, and it's centered in understanding that people have different experiences. And so this task force is providing us an opportunity to understand, so sorry, providing us an opportunity to understand uh, the differences in health and the differences in experiences that people have in relationship to health. And so I'm excited to be a part of that task group. And so we will be producing, and you're a member of it as well, and we'll be producing recommendations over time. And so I led with that the discussion of the task force because at its core, when we are looking at what's happening now, when we are looking at what has happened with COVID-19, what we need to understand is that people have different experiences in the environments that they live in. And so those different experiences need to be acknowledged. And so as a public health practitioner, that is a core function, well, a core principle that I live by in developing programming and services for the communities which I am blessed to work with and to work for.
Awesome. Well, with everything going on in our country, we have COVID and
Mhm.
its particular impact on older adults, on Black people, on Indigenous people, on people with underlying health conditions, as well as what's going on in our country around our citizens exercising their First Amendment right to protest. I keep thinking we can't forget that COVID is still alive and well across our region, and I'm open to everyone exercising their First Amendment right. So what messages do you want to reiterate about safety or other topics during this time?
I think it's important to reiterate that while people are practicing their rights, that we are still in the middle of a pandemic. And so it's still important that people, as best they can, they practice social distancing. And by that, I mean staying 6 feet apart from one another, again, as best they can. The other thing that I think is important, and I'm glad to say that I've been seeing it, is that it's still important to wear masks covering one's nose and mouth. And thirdly, I think that it's important that if a person is ill or sick, and they are in the age range of 65 and older, and they may have underlying health issues, that it may not be a good idea for them to participate in some of these activities, given that we know that individuals who are 65 years and older and individuals who have underlying health issues could possibly become severely ill if they acquire COVID-19. And so I think it's those three things. Understand one's risk, and if one is sick, don't go out. If one does practice their right, exercise their right, it's important that you mask up. And it's also important that you still distance yourself 6 feet or more from individuals. And of course, continue to sanitize, carry hand sanitizer on one's person.
Thank you for that. And I know, also there are resources in the community. So, even if people are going out and they do want to get tested, there are resources that exist. Is that right? Throughout the state and throughout, well, greater New Orleans and across the state where
Yeah.
people can get tested, regardless of if they have symptoms, I believe.
I still think that there might be some things in place. I think there are some areas where testing is available um, uh, based on resources, regardless of symptoms. But resources are out there. And if a person is wanting to find out information, I think it's important that they know that 211, please call 211. And the individuals on that line will be able to direct you in the to the right place to get what you need to get testing and to also find other resources, health resources that you may need.
Thank you. And 211 is a statewide number too. So wanted to
Mhm.
put that out there. So lastly, we're in the month of June. I can't believe we're in the month of June already.
I know.
And June is a month that's so special for many of us.
Mhm.
It's Pride Month, so a time when the world's LGBTQ community can celebrate the freedom to be themselves. Also, Juneteenth,
Mhm.
which is on June 19th, and it refers to Freedom Day or Emancipation Day, which is celebrated by many Black Americans and now other Americans in the US. And it originated in Texas, but it really commemorates the announcement of the abolition of slavery and emancipation of slaves on June 19th, 1865.
Mhm.
When I thought about these two, days or the month, among both of those, I think about freedom. And so, what are you doing at LDH or individually to observe Pride Month and or Juneteenth? And maybe in that, talk about again why it's important for us to be reminded of this history in our equity journey.
Right. So I want to start where I started when we initially had this conversation. Both of those events are important because they speak to people having different experiences. And so it's important that we understand that African Americans have had different experiences inside where they live. And it's important that we understand and take those experiences into consideration when developing programming and services. It's also important for the same reason that we understand that LGBT individuals have had different experiences, and it does affect their health outcomes. So for me, there's an importance constantly when thinking about health equity work to be concerned with people's experiences. And so that's at the forefront of my mind. Additionally, at LDH is, again, as I stated earlier, the governor has developed the Health Equity Task Force, and that task force is centered in coming up with solutions and also understanding the COVID-19 disparity specifically in the African American and Latino experience inside Louisiana. And so that's one thing we can speak to that highlights LDH, understanding that people are having different experiences. And then inside the office, inside LDH, we will likely in our monthly or weekly newsletter have information about Pride Month and what that means and why it is significant. What we do know is that many LGBT individuals are having different experiences when it comes to the healthcare system. And so sometimes, just to give an example, because of negative experiences that may be had when they engage the healthcare system, they may stay out of care for a long time. And so by acknowledging differences in experiences and celebrating that we are different, we can demonstrate to people that they are important, that they are valuable, and that can help to improve people's self-esteem and help to empower them to understand their place in the society and help us as LDH to just better be aware of what experiences people are having and use that information to inform the work that we do so that when we create a program, it is a program that is informed by people's environments. It is a program that is informed by social and economic factors, because we know all of these factors affect the health and the well-being of people.
Well, I do appreciate you for being here. This kind of wraps up our segment, but I know the one thing that is going to stick with me about what you've shared is that we all bring our individual experiences into our work, and we all have our own individual experiences.
Yes.
And as we're working and a part of this equity journey, we have to be reminded of that.
Yeah.
I think about empathy too when I think about a
Yeah.
person's experience. So I do want to say thank you so much for being with us today, Dr. Benjamin Robinson, and please stay safe and well.
Thank you for having me.
So thank you so much for joining us for this very important edition of Health Table Talk. I hope you learned something new through our conversation and about the importance of health and racial equity and dismantling systemic racism in all of its forms. Before we close, I want to invite each of you again to join us as we commit ourselves and our organizations to addressing racial and health equity and addressing racism as a public health issue. Again, we call upon all of you who are listening and or watching us through Health Table Talk, our policymakers, our partners, our fellow Louisianans to join us in identifying and adopting anti-racist policies so that we can uphold the human right to be healthy and well. I want to remind all of you the importance of protecting yourself and each other going forward. Remember to mask up to protect yourself and those around you during COVID-19. Stay at home during phase 2, especially if you're sick or have a diagnosis of COVID-19. If you're 65 and older or have a pre-existing condition, please stay home and have a neighbor support you during this time. And remember to physically distance but stay socially connected. It's important that when we're out in public to ensure that we're at least 6 feet away from each other when we can. You know, COVID-19 is not yet over. We must still remain vigilant. So until next time, stay safe and well. And remember, now more than ever, we will get through this together.